If you're limited in flexion because of pain or pinching or something behind the knee. All right, guys, so I know I've been talking about the massage gun in different positions when I'm working on stretching and range of motion. So this is a terminal knee extension, right? Knee extension, knee flexion. This particular device, it's a hydraulic resistance. Most of you are gonna have what's called a selectorized equipment. It's got the pin and the weight stack. It doesn't matter. It doesn't matter what you have. What I like about this is when I've got an individual who's had a right total knee replacement, I'm looking at certain benchmarks and I want you to objectively see improvement, right? So maybe on session number 1, we can't get the knee back inside the carriage. So I use my non-surgical knee to lift. I put my knee in there. I use my surgical knee to extend, and then I allow gravity to work on pulling the knee back into flexion. So whether I've got weights attached, whether I've got a hydraulic piston, whatever the situation, I'm pressing up against resistance. I'm allowing gravity to bring the carriage back. I can put my non-surgical leg on top if I want a little added resistance. But that is where the massage gun comes in. So what I know is going on here in a certain scenario is my muscle is resisting the tension of the carriage pulling me back into flexion. I personally would always recommend you go low to high, distal to proximal. So what I'm doing is I'm not pressing down. I'm literally letting the weight of the gun do the work, and it feels so weird. Now, granted, I didn't have a knee replacement. You did. I would probably use a strategy like this for somebody who's 4 weeks, 6 weeks, or longer post-op. Maybe you're struggling to get to 90 degrees. And so what I'm doing is I'm letting it rest on the tissue, and I'm gently, slowly gliding it up. Now, if you're just really restricted, and let's say you're not even getting down close to it, I can do the same thing. I can literally just let it sit there. I can allow the sensation of the vibration to give my brain and my nervous system something else to feel. And with gravity and this stimulation, what should happen is the leg should eventually kind of relax and allow the flexion to happen. I think the main thing that we need to ask ourselves is what's limiting the flexion. If I try to bend my knee and I get pain or pinching in the back, it's not tightness in the joint capsule. There's something else going on behind there. It could be an impingement, it could be other stuff. If I go to bend and I feel tightness through the front, tightness across the top of the shin, okay, so now we're dealing with stretching the connective tissue. I should feel no pain or discomfort behind the knee. These are very different scenarios that require very different interventions. So if you're limited in flexion, you want to determine, is the limitation because of the tightness in the front of the knee? If it is, that's great. That means we stretch it more. If you're limited in flexion because of pain or pinching or something behind the knee, more stretching probably isn't the right solution. We need to talk to a physical therapist. We need to consider joint mobs and some other things. But certainly using the massage gun in a position like this to facilitate flexion simply by letting it stimulate those touch receptors is a great way to work on improving range of motion, improve tissue healing, tissue recovery, facilitate circulation. So guys, I'll shoot a couple more of these videos for you. I just wanted to give you some ideas right now on other stuff you can do with the massage gun while you're working on the range of motion. All right, guys, I'll talk to you soon.